The CryoPen, moving cryosurgery into the 21st century. The CryoPen is the greatest advancement in cryotherapy for the treatment of skin lesions in the last 60 years, eliminating the need for the use of dangerous cryogenic liquids and gases. The CryoPen also eliminates the need for expensive, disposable purchases that are typically required to maintain a cryotherapy system. The CryoPen is simple, safe, effective, and can generate new revenue for your practice while improving patient care. Using the CryoPen is as simple as 1, 2, 3 because it is non-technique dependent. Select the correct size tip, extract the pen core and lock into the tip, then freeze the lesion. It's that easy. In fact, if you can operate a laser pointer, you can use the CryoPen. Your medical staff can now complete cryotherapy procedures with your supervision. This means the CryoPen can add more procedures to your practice without slowing you down. With the CryoPen, there are no messes to clean up, no handling issues, and no ventilation requirements. Maintenance is simple, and there are little or no required disposables. No more running out of liquid nitrogen. No more purchases of expensive cans of gases typically used for cryosurgery. Our system comes with everything you need, right out of the box.
The CryoPen is so simple to use, there's no preparation necessary. Plus, it's great to be able to treat skin lesions without the use of an assistant or extra supplies.
The CryoPen is safe because it uses no dangerous cryogenic liquids or gases to deliver the cryotherapy to the lesion. Other devices require handling dangerous liquids such as liquid nitrogen or even potentially deadly gases such as nitrous oxide. The CryoPen allows the practitioner to treat more sensitive areas of the body without the challenges and dangers of other cryotherapy methods.
I find that using the CryoPen is very safe with no significant complications, no burning, scarring, or stitches. Plus, the procedures are not painful. Most patients experience only minor discomfort after the procedure.
The CryoPen is extremely effective due to its pen-like precision and ultra-cold temperature. The CryoPen comes with a range of cryosurgery tips that give you precise pen-like control. These tips come in 3mm, 5mm, 7mm, and 10mm sizes to ensure the right freeze diameter for the specific lesion. This allows you to freeze just the lesion in question, even in the most sensitive areas, while reducing damage to healthy surrounding tissue. The patient results include less pain and a smaller recovery zone. The CryoPen uses ultra-cold cryotherapy at temperatures of -105 degrees Celsius for effective treatment of a wide range of skin lesions. As seen in this demonstration, the CryoPen extracts heat from the proper depth to ensure the proper cryotherapy is delivered to the patient. From pediatrics to geriatrics, the CryoPen is the right device for cryosurgery, effective for treating a variety of indications. Recently, podiatrists have flocked to the CryoPen for its tremendous results on plantar warts, which are notoriously tough to treat.
The CryoPen treats lesions quickly and effectively. In fact, most lesions can be treated within 1 to 2 minutes.
This is why the CryoPen is simple, safe, and effective. Cryotherapy treatments are quickly becoming commonplace in the physician's office and represent a significant stream of revenue. The ability to service your patient's needs without adding to your workload and to generate additional income for your practice make the reasons all the more compelling to purchase the CryoPen. The CryoPen makes your office more efficient by enabling your medical staff to complete these procedures under your supervision. Billing is simple, and coding for cryotherapy procedures is a very common practice. The CryoPen has virtually no disposables, which can be expensive, and many of our customers who purchase a CryoPen have seen the ability to recover their investment in less than 6 months. The CryoPen is simple, safe, and effective. It can make your office more efficient and can generate significant additional revenue for your busy practice. It's time to move cryosurgery into the 21st century by moving away from dangerous, expensive, and technique-dependent cryogenic liquids or gases, and move to the most innovative solution available today in cryotherapy, the CryoPen. The CryoPen is the right investment for your patients and your practice. Our customers love the CryoPen, and we know you will too.
Thank you for watching the CryoPen informational video. I'm Dr. Michael Haas, creator of the CryoPen system. The video you just watched describes the CryoPen in the field of dermatology. I'm excited to introduce to you our latest innovation, the CryoPen gynecologic attachment for cervical cryosurgery. Cervical attachment works much the same way as the skin attachments work, with a few aesthetic differences. The base machine for the cervical freeze is the same. The pen cores and tips are different. All the cervical attachment parts are a different color, green. Just as the skin system is able to perform cryosurgery without dangerous liquids or gases, so does a procedure for cervical freezing. I will demonstrate for you how the gynecologic cervical freeze device works and perform a sample procedure using ballistic gelatin as a clear visual. Ballistic gelatin is an excellent cervical tissue analog for demonstration purposes. This is a mock-up teaching cervical demonstration tool with ballistic gelatin attached. A speculum will be inserted that will show the relative size of the CryoPen gynecologic freeze system. Ballistic gelatin is used in law enforcement and is a perfect tissue analog for demonstrating cryosurgery. To perform a cervical freeze, you would pick an appropriate size tip, in this situation a 19 millimeter, and attach it to the GYN handle. Then an assistant would test the pen core for readiness. You would place the tip on the patient's cervix, then insert the cold pen core into the handle, which will start the cervical freeze. Like the dermatologic system, there is no need to vent dangerous gases like nitrous oxide or CO2. The patient benefits both by not being exposed to these dangerous gases or liquids, but also the convenience of immediate treatment at the time the doctor feels it's appropriate. Physicians find it incredibly easy to use, and for your practice, it's a significant revenue generator and profit center without hazardous gases, liquids, or OSHA requirements, and it keeps patient care and reimbursement in-house. To effect a deep freeze, after 1 minute, swap to another cold core and continue freezing for 2 additional minutes. Three minutes have since elapsed. When the freeze is completed, replace the cold core with a room temperature core to defrost the tip off of the cervix. Thanks for spending time to learn about the CryoPen cryosurgical system.